Dr. Vijay Bhaskar, Chairman, Ethics Committee, Clinical Research and Trials, Hyderabad. Today we are going to discuss about common flu symptoms and signs, and then COVID SARS-CoV-2 virus. We are all aware that the common flu is common in the children and then adults, where they are more prone for the seasonal variation like cold and monsoon season. That time there is a possibility of spreading of the virus in the area, or whether it is an epidemic or endemic or pandemic. So, COVID, we are all aware of that, and COVID and common flu disease are quite similar, but the severity of the disease in corona or COVID SARS-CoV-2 is little very high. So, as usually in common flu we see cold, rhinitis, like means nose, and there is a mild fever, and there is a sore throat, and then following that there is a respiratory symptoms like upper respiratory and lower respiratory. Upper respiratory symptoms like cough, cold, and then sore throat. Lower respiratory symptoms like deep breathing, severe cough with the sputum, and then breathlessness, shortness of breathing, and all that. So, in corona, as usually we see all these symptoms like flu, along with them there is a decreased taste, smell, then there is a possibility of gastrointestinal symptoms. The person will have loose motions, diarrhea, and then there is certain symptoms like body pain, severe joint pains. So, these are the common symptoms which are we see it in common flu and then the COVID SARS-CoV-2. But where which is important, it all depends on the which variant is affected by RT-PCR and gene sequence study in virology lab. When we see that a specific generalized virus is affected, it will wean down, or it will takes a period of 7 to 14 days to wean down, irrespective of infection, irrespective of virus. But certain times when a pneumonia or flu like symptoms associated with bacterial infection, then they will turn into severe respiratory syndrome, or severe respiratory infection leads to complications like breathlessness, ICU setup, and there is a possibility of ventilator support, and if certain people will not cope up, then there is a possibility of death irrespective of. But as usually many flu, pneumonia, we have vaccine support to protect ourselves. Rather now for the SARS-CoV-2 COVID virus also has a sufficient antiviral drugs as well as the vaccines which protects from the disease or decreasing the viral load. But overall, whatever you see, whether the flu symptoms, we must confirm with an RT-PCR test and the ESR, CRP levels to see the amount of disease in our body and the response to the drugs. Now, apart from that, you should see whether there is a possibility of in generalized pneumonia. We do not see much of clotting factors or clots in the lungs, usually which happens in the COVID, where there is a lot of inflammatory changes, edema in the lungs lead to the inflammatory reaction, and then there is a small clots in the vessels which leads to pulmonary embolism, that is the increase in D dimer, where it needs a lot of steroid and lot of low molecular weight heparin. And sometimes if the disease severity is more there in COVID, we should give tocilizumab or any other severe antiviral drugs. So, likewise we should see the difference between generalized flu disease and the COVID disease.